Also, what I mentioned earlier in the week was that the extension of our next executive order will be on Monday. And I've just preferred to give some folks some heads up going into the weekend about kind of what we're thinking, the numbers. You always hear from Dr. Box first, which kind of sets the stage. And I did want to also say thank you to all the Hoosiers who really took to heart what we've been asking folks to do. 99.99% of Hoosiers are stepping up and playing by the rules or with the program. They understand this is not about me. This is about all of us. And we're in it together. We're going to get through it together. And the more folks who are with the program means that we get through it more efficiently and safely. And so that means you've stayed home and that hunkered down. And that means you've stayed healthy to the extent that you have control over. That means you've stayed connected with all the information, and we're just very, very appreciative. We've been hard at work, this whole task force, and this extraordinary hospital network system that we have here in the state of Indiana to make sure that we've not just accessed, but also developed supply lines in terms of PPE, that personal protective equipment, throughout the whole state of Indiana. We've made a lot of progress on that front, as have other states around the country, but that is not to deter anyone who is also pitching in, those sewing groups in Boone County, Indiana, that are supplying their local grocery store or their hospital. We still need you to do that. I just underscore this to say that we're in a different position now than we were just weeks ago. Still have a lot of days ahead, and we'll continue to dial up and make orders where we see fit. But hospitals will continue to have their supply chains intact. We'll, as a state, continue to build up our strategic state supply as the days go forward. And we've been operating in very responsible 2-week increments in terms of these executive orders, so that allows us to appropriately adjust or accommodate these facts on the ground as they come into our portal. That phase, as was just mentioned by Dr. Yaletti, I know it makes all of us anxious and stir crazy at times, and we get cabin fever. It's very understandable, but we're making progress because of it, and we don't want to prematurely change what we're doing just to hope for a different result. It is working. Having said that, our containment policies and our capacity issues, the management of them, has put us in a position to where we're now in the phase where we're planning on a safe reopen concerning different sectors of our economy. That's why yesterday I mentioned that we sent out communication to various associations soliciting their input. We've asked them to return that input by the 22nd of April, which would be Wednesday next week. Fairly quick turnaround, but a lot of companies, talked to some earlier this morning, have already started in anticipation for this phase, put together plans in place for a safe reopen. And so we've reached out to our manufacturers, our realtors, our retailers, our restaurateurs, tourism, from small business to the largest businesses, largest employers we have in the state of Indiana, to legislators, to mayors, to all the local officials, because again, we're in this together, soliciting their ideas for these safe openings, understanding that the state of Indiana is 92 counties, we've got 10 different health districts and regions, so to speak, and we'll continue to manage it in that way. On Monday, I will be extending the executive order, that Hunker Down Hoosiers order, to May 1st. And so we've shortened the duration. That's not to say that we're going to pull up immediately after that. It just means it's going to allow us to make some changes or some tweaks, some accommodations as we see appropriate around the state of Indiana. As an example, we'll continue to work with the Indiana Hospital Association for a kind of in a staged way with their members in terms of elective procedures, because we have a handle in a large part of our state on the PPE inventory. And so that would be an example, in addition to the shortened duration of the executive order, also items like elective procedures will change just a bit, opening up. And again, I just want to say there is a lot of work that needs to be done between now and May 1st, between now and April 22nd, and then May 1st. And then there will be after that as well. But this is going to allow us to make sure that we're all on the same page as a state in this together, one Indiana, monitoring our positive case numbers day by day, where they're coming from, maintaining our supply pipelines and levels, continuing the testing in different ways, in different places, making sure that we're building out our contact tracing program, and then, of course, reviewing our business sectors' ideas for how they will safely reopen for their own sake, for the employees' sake, obviously, and for the customers. And I'm really encouraged by what we've already seen from folks who have been sending in their plans, how much thought that is going into this, or I should say, rather, moving away from the who does business to how we do business and when as they come online, including your own state government. And so we're holding ourselves accountable to this as well, and we've got every agency out putting together their plan for reentry as well. So again, I want to stress, I mentioned, and we'll get right to the questions here, but I mentioned also yesterday that we rightfully reached out to our neighboring states, even beyond that, into the Great Lakes region, and wanted to make a point that we would be working with our neighbors. We did not want to surprise anyone. We share borders, and you can just imagine we've got hospitals right on the border of large population centers. We've got retailers right on the borders of on the other side of the river or up on the Great Lakes region. And you can imagine if we do something before or after or at the same time simultaneously, that cause and effect that it would have. That's not to suggest that we are anchored to or on everyone else's timeline. It just means we're being good neighbors. And we're going to share the information about where we are and how we'll manage inside of our state and move forward together as a state and as a nation. And with that, Rachel, we're happy to take any question that's on anyone's mind.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. Happy Friday. A couple of questions about what tweaks might be made to the executive order. You indicated earlier in the week that there would be some changes in this version. If I understand you correctly, the consultation about elective procedures, that's coming up on the next revision. What's going to be different about this one from what we've seen? And specifically, at whatever point we get to reopening restaurants and bars for sit-down service, the White House guidance.
We'll get there.
Well, I had a specific question about that, not when's it going to happen.
Okay.
The guidance from the White House suggested that bars should stay closed longer than restaurants, that even when restaurants reopen, the bars may not. What's the rationale for that distinction? Is that a distinction you would expect to make at the state level?
Feel free to chime in here, but I've got the recommendations from the White House. We did, as I mentioned yesterday, I joined that call with the President, the Vice President, his whole entire task force team. I was 30 minutes tardy, but I was here. I had a good excuse. They knew that. And they have supplied us with their guidance. And as you mentioned, Eric, it is that. It is guidance, and it is reasoned and sound and thoughtful. A lot of work has gone into their national recommendations on how to approach this. Obviously, they contemplated that different regions of the country were in different phases or stages of this pandemic. And they also contemplate, most importantly, that what we don't want to do, one of the worst things that could happen is if we get this resurgence. So you have to prevent putting yourself into a position where there is a resurgence of COVID-19. You talk about the hit that would take to the American psyche. And so we're going to be very responsible, very methodical. I mentioned that we're going to work with our Indiana Hospital Association to make sure that we're in touch at the street level with the supply levels of PPE that may be in high demand. While we may talk to one region of the state, I'm pointing towards southwestern Indiana right now, that is in solid shape. There are other parts of the state where if they heard me say, we're good, we don't need any more PPE, they would say, Eric, I would get a call very soon. And they would remind me about the need. And that's why I said at the very outset that we need folks who are firing up those 3D printers and helping us make face shields, the Department of Corrections who's helping us make gowns, the sewing groups that are all over the state of Indiana, Berry Plastics down in Evansville. And I could just go on and on and on about all the contributions that folks are making. So to answer your question, Eric, that's what this time between today, the 17th of April, and May 1, it's exactly what we're reviewing all of the ideas across the state of Indiana that would lead to some changes. I just alluded to a couple of them. One is that we're shortening the time frame because we know of the progress that we're making in some areas and some things that we can do, but we'll take this approach in an ongoing fashion.
So the only thing I'd add to that, Eric, is I think there's a little bit of difference with a restaurant that can separate their tables and have individuals sit down as a family a lot of times or very close-knit friends versus a bar, which I don't spend a lot of time in them anymore, but I can remember a lot of, person-to-person, very close contact and a lot of enjoyment going on, but not necessarily a lot of social distancing. So I think that may be a part of what the concern is.
Steve, KPC Media.
Good afternoon, Steve.
Good afternoon, Governor. I wanted to start off by thanking Dr. Box for the great statistics that we got today. Very happy to see those. But today my question will be for Commissioner Payne, if he's around there with you.
He's making his way up. Steve, you can take a little credit for that information that's incorporated into the slideshow. And thanks for your patience.
I needle Dr. Box with a lot of questions, but
they're very helpful.
Going in a different direction today. So I wanted to ask, today we got the state's employment report for March, which reported a March unemployment rate of 3.2%. And please don't take this the wrong way, but I laughed at that, knowing that was not a complete number. And it looked like that was only through March 12th, really before we got into the bulk of the COVID impact here. So I wanted to just ask, is that typical? Do we have numbers that look at a full month? Do we have an idea of what the true March unemployment rate is? And when we get our more detailed county level report on Monday, should we expect a full month or should we just expect this snapshot view again?
Those are good questions, Stephen. Thanks for asking. The monthly employment report is a coordinated effort throughout the nation. All of the states and our federal government, we have a specific time frame in which we report numbers. That time frame covers the week that includes the 12th day of the month. So you're really looking from midway from month to month. So for March, that week actually ended right before we started seeing a surge in our unemployment claims. So if you look at the week ending March 14th, if you recall, we may have had about 2,500 claims filed that week. But then the following week was when we saw the huge surge. So that number only captures the week before. It doesn't fully capture what's actually happened the second half of the month. And if you look around the nation, you will see that the unemployment rate only jumped slightly for some states. Some jumped a little bit more than Indiana because they started seeing unemployment claims filed probably a week before, like Ohio. some instances, I think, Kentucky, and to some small degree, Illinois. So what we'll see in the next month's report will be more reflective of what's happening now, because it will cover the second part of March and actually the first few weeks in April. And that's also one of the reasons why on Thursday we report our unemployment claims numbers on a week-to-week basis, because that's actually more reflective of what's happening now.
Fred, you mind, your staff, Herculean effort, pulled an all-nighter, obviously, to get positioned for today. And I threw out a figure there, and it was $200 million that kind of probably just zoomed right by some folks. You want to talk about, come Monday, you want to talk about all the work that's going on, how fast you've turned and burned to get this, from the federal help that we received out the door into people's bank accounts.
Sure. Yes, Governor. So the Governor is referring really to the pandemic unemployment compensation and the additional benefits that we've really worked right around the clock to make sure that we're delivering. If you recall, we received guidance sometime late March on how to apply and how to implement those programs, and we quickly turned around within about a 2-week time period actually updates to our system to make sure that we were providing those payments for the additional $600 a week under the pandemic unemployment compensation. So last night, we had anticipated the uplink system to be offline for about 3 hours. It was actually offline for probably about an hour and a half. So we were a little bit ahead of schedule on that. And so payments started dropping today. We had some to start drop today, but then we have in the queue payments to start dropping on Monday, somewhere to the tune of about $200 million in payments of those $600 increments. Keep in mind, those payments are retroactive. That encompasses people who've already filed claims from March 28th or the week ending April 4th.
Thanks to your team for operating at the speed of the need.
Corey Williams, The Associated Press.
Yep. Good afternoon, Corey.
Good afternoon, Governor. Can you hear me?
I can.
All right, I have a quick one for you. I'm calling from Michigan. We're doing a double team state thing on you guys here. If you guys are able, and some of the other states are able to do a rollout, are you envisioning weeks or months? Some people are thinking that maybe they'll be back to work in early June, but conceivably, could it take into the deep summer before everyone, if they're able to get back to work, gets back to work?
Well, that remains to be seen by the numbers as they come in. And do our mitigation efforts continue to work? Are we continuing to make progress? Where is that progress occurring? That's why I was tried to be clear about the fact that we're going to continue to work with our neighbors to make sure they know what we're doing, so that our action, we understand, could have a reaction or an equal or greater reaction from someone across the border. We want our neighbors to know what we're doing, but we're not going to say this will. We don't know. We don't. Anybody that tells you some date specific, 2 week or 1 month or 2 months, and how that plays out into all the different sectors of your economy, whether it's schools or state government or the private sector or the philanthropic community. This is all going, the way we do business will be different. What we know will be a prerequisite is that it will have to be done safely and when it's safe to do business. And so we'll continue to work with the Governor Whitmer, and we'll continue to work with Governor Pritzker, we'll continue to work with Governor Beshear and Governor DeWine, and further out from that, so that they know how our region, all the pieces that snap together of this puzzle are functioning and the progress that we're making. And we'll continue to, if we see, someone else have a good idea, we'll look to implement it here as well. We won't dither. Care to add anything about the regional approach?
Ditto.
Yeah, ditto.
Jeff Smith, WLFI.
Hello, Jeff. Good afternoon.
Good afternoon, Governor. Dr. Box, I think this is probably more for you, and I hope it's a no news is good news situation. But in all the discussion about long-term care facilities, and in fact, I think since we've been discussing COVID with you, there has never been any mention of the Indiana Veterans Home here in Tippecanoe County. Can you give us snapshot of what that looks like in terms of patients and staff members?
Off the top of my head, I don't have that. Again, we're only going to give aggregate data, but I do know that we went in there early on. I think we tested some individuals and really worked with them to make sure that they had the PPE they needed to protect all their residents there, and talked about their infection control procedures. And so, yes, it's not come on my radar, so I think that is a no news is good news.
Dan Klein, Wish TV.
Good afternoon, Dan.
Good afternoon, Governor. I hate to be the negative Nancy, but I think a lot of people are worried in the aspect of, I think we can go through this once, but 4 months from now, 6 months from now, when obviously no one can see the future, but when there are more cases maybe coming together, when it's schools back in session in the fall, do you think this is going to be a reoccurring thing, or what types of things can be done to keep this from being more than just a one-time thing?
Well, there's a lot of good news. And I understand the anxiety or folks being nervous. This is a pandemic, by definition, a global occurrence that came washing upon our shores in a very swift manner. And fortunately, we were nimble enough and collected and organized to where we came together equally fast. And a lot of credit goes to our first-line responders, whether it's EMS or police or the hospital system at large across our whole state of Indiana, to be able to accommodate that first rush and that surge. Everything that we've been doing is designed to try to mitigate that surge. And to date, I'm not celebrating, but we've kind of flattened that curve. We've kind of drawn it out so we can, as a state, handle COVID-19. Having said that, with every death that is reported, you just heard from Dr. Romuletti, who really knocked him down for weeks on end, and his wife, when this hits, it hits hard and drains a lot of resources. Our goal in this all has been able to get in it and then get out of it responsibly, safely, as fast as we can, and be able to handle anything that could wash back up on shore. It's, the good news is, and please add where I'm deficient here, but I mean, our health, our local health offices, in conjunction with your partnership, obviously, in the state and our hospital system, we're going to be in a much better place after this ordeal than we were before it. We just maybe didn't know what we didn't know.
I think the point is that if we do see another wave of this in the fall, and again, remember, this is the novel coronavirus. We don't know exactly what it's going to do. We can't predict it. Certainly, there's a thought process that we could see a wave of this again in the fall, and we're not expecting the vaccine to even become available till the fourth quarter here. So we won't have a lot of people that are immunized, but what we will have is better testing capabilities. We can test people, we can isolate and quarantine people, and we can make sure that we are able to stay on top of that. We'll have the PPE that we need to be able to provide for our frontline EMS and other individuals. Our hospitals will have time to kind of recuperate and get back on their feet and have more of their personal protective equipment. So if it comes, we'll be ready for it, and at that point in time, we'll have to see what's happening and keep track through contact tracing of the number of cases that we have and increase testing, and so we'll know what we need to do at that time.
Matt with WFIU.
Hello, Matt.
Good afternoon, Governor. My first question is for you, and the second one is for Dr. Box. Do you plan to, or are you considering to designate grocery store workers as first responders? And Dr. Box, some counties are reporting testing anyone with symptoms and others have very limited testing. Is the Department of Health planning to make any statewide testing protocol for who gets tested and when?
We have not to date. We have prioritized them as essential workers, and so there are some benefits to that in terms of child care and how we treat them as essential workers. And you want to take the second part of his question?
Sure. So to date, there's no specific plan about testing in every single county, but I can tell you that we have been doing drive-throughs. We'll be doing more drive-throughs. We shortly will be receiving the cassettes for our Abbott testing, so we'll be able to place those in some of our more rural areas so that we can have that quicker turnaround time. I did just receive, or will be receiving, I got notice, 100,000 swabs. So like that's the best Christmas present that I've had in many, many years. So I think from that standpoint, it's really looking up. What I want everyone to know now is if you are seeing somebody who is symptomatic and you suspect they have COVID-19, test them. It's fine. Test them. You can send to LabCorp. You can send to Quest. You can send to me if you're concerned that we need a quicker turnaround time and we can get it done through Lilly, through IU Health, or some of our other local labs. So it's wide open. If individuals are symptomatic and the healthcare personnel thinks that that individual has COVID-19, please test.
Lindsay Doty, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. I know we don't know when this will be, but when this happens, which type of workers do you think will be among that first wave of those who can go back to work? Are you thinking it's people who work in traditional offices or manufacturing employees or some other sector?
Well, I'm not trying to hide the ball, Lindsay, honestly, but that's exactly what we're doing, going through every sector. That's why we sent out about a letter to about 17 different associations, because we didn't want to act like we had all the answers right now. If they were seeing something, if they wanted to share how they would be able to safely conduct business, I don't want to discount, obviously, the folks who are running their businesses. They know how to act safely. So you'll have to wait until Monday, and then until May 1st as we start to very methodically pull more and more folks back online.